once again to another session of our friend hospital house Zoom meeting, also on Facebook Live for those that can connect on Facebook. It's very important to discuss an issue of this nature at this time, particularly even the world itself in general recognizes on the 28th of July every year is referred to as World Hepatitis Day.
So why are we bringing it up to us at this time? It's very, very important because we have gone to realize so many faults from our membership that do not know much about hepatitis, and it's quite painful. So our friend hospital have started enlightenment on different platforms for the past 3-4 days about what is hepatitis and what it involves. Now we want to blow it out more in order to reach out to people. So I want you to go along with me. It's an interesting thing for you and I to know. And main thing for you to pick up today is that if you are found to be negative, ensure you take the vaccine. That's an important message I want you to take away from this lecture. So, what does it mean to say hepatitis? For those of you that can see me to some extent, I want to remind you of the human body. The human body is made of different parts. Hepatitis is referring to liver. The question is that where is your liver? Now, if you look at the right side of your tummy, on this part I'm touching, that's where your liver is. Under the rib here, down below a little bit on the right side, that's where your liver is. And this liver, it's one of the major organs. There are two, big and small, joined together. This particular organ is like the generator of human body. It performs various functions that are very, very useful. That once there's any disease affecting it, it will affect the human being, and the human being is going to suffer a lot of setback. For instance, liver is responsible in producing some hormones. Liver is responsible in making some digestion to occur. Liver is responsible in storing your glucose. Liver is responsible in providing some immunity. Liver is responsible in producing blood. So many functions liver does. Now, if anything happens to the liver, the body of that human being will suffer a lot of setback. So, the word hepatitis, you may not be able to link up with liver. So, it comes from Greek word. Hepa means liver. Hepa, H-E-P-A-R means liver in Greek language. Itis means inflammation. What is inflammation? This may look like a medical word. Inflammation means when there is a heat generated in a place that's ordinarily cold or normal, and then get its function disorganized. So that process of generating heat and then disrupting the normal activities of such organ is referred to as inflammation. So hepatitis now means inflammation of the liver. So that is the basic meaning of what hepatitis means. What are the causes of hepatitis? Now, we have different types of hepatitis. The first thing that what affects it mostly that we're discussing today is virus. And today, you have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. 5A to E hepatitis exist. Now, you need to understand that these hepatitis I've mentioned, they are virus. And what do you mean by virus? As you exist as a human being, and you have goats, you have cats in their own world, so also we have other microorganisms that you cannot see with your naked eyes. You have bacteria, you have parasites, you have protozoans, you have virus. So virus also belong to different family. Now, coronavirus is a virus. So hepatitis virus is also a virus in their own world. Now today, hepatitis A is found to be what we get from what we eat. So food we consume, water we consume can be a source of hepatitis A. Hepatitis B is different from that. Hepatitis B is contacted through an individual who already have the disease. Now, having contact with such person's body or the person's body water like blood, semen, secretions, saliva, sweat, and so on that comes out from such person's body other person can get the disease from him. Now, similarly, hepatitis C the same way, hepatitis D the same way, hepatitis E the same way. Now, B, C, D, E can be contacted almost the same way. It's only hepatitis A that's different from the remaining four of them. Therefore, on this point, it means that we are discussing more on hepatitis B because this is the dangerous one that is common in Africa, common among people. And I want us to learn this very carefully. Majority of us are very scared of HIV. We are scared of coronavirus. We are scared of some other disease, cancer. Unfortunately, most of us are not aware that hepatitis is more deadly and is more dangerous. Why it is very dangerous and deadly is this. When an individual gets this disease, you don't manifest any symptoms. For not manifesting any symptoms, that alone will hide to mean that there's no disease. And by the time an individual manifests the disease, the liver must have been damaged over 25%. This is an important issue. That a disease that comes up and an individual does not know that is having the disease until the liver must have been damaged over 25%. And that is why we are discussing this matter today. That it is very necessary for you and I to know that it is a disease that can destroy an individual. A number of people are dying of this disease. Now, if you look at it in Africa, Nigeria particularly, more than 1.5 million people died per year on account of hepatitis B virus. In America, no less than 1.8 people die of hepatitis B virus per year. So this tells us that this is a disease that kills a number of people. And the unfortunate thing is that it spread very fast and continuously spread because the individual that has it can transmit to another person who is not aware he has the disease. So that's a very big problem to any individual that cares. The second thing that you need to know, what are the symptoms that an individual will manifest if you already caught this disease? There are numerous symptoms and signs that will mimic, that look similar to other disease. I want to warn you very carefully. Enough of your self-medication. Enough of your attitude of I don't care. Enough of your belief that I can always find a way around it. Enough of your conception that no, those doctors just want to collect money. You better get this message clear today. Number one, you can begin to have fever. Don't forget, fever also exists in typhoid, there is in malaria and some other disease. Number two, you can have abdominal pain. Begin to have pain in your tummy, especially on the right side, upper side of your tummy. Beware, something must be wrong. The liver is giving you signal. It can be pain. Number three, you can experience loss of appetite. You realize that you cannot eat very well again. Your appetite keep going down all the time. And the next thing, you begin to lose weight. I cannot explain why you're losing weight. Beware, something is wrong. These are basic symptoms of hepatitis B virus that have succeeded in staying in somebody's liver. Number four, you can begin to have pain all over your joints. That also may make malaria. Thinking that it's malaria. No. Be watchful. If you finish treating malaria and yet the pain in your joints remain or persist, beware, you need to check out. Something must be wrong. Number five, you realize that your urine becomes dark color. You went to urinate and you see that it's now very color, dark in color. And as if it's like a Coca-Cola. Beware, malaria also can make like that, but it can be more than that. So you have to be very careful that what am I dealing with? So by the time you're experiencing those ones I've mentioned, that tells you that something is wrong somewhere. Or you now realize that most of the time you feel like vomiting. And as a man, you're not pregnant, and not a lady that is pregnant, or you realize you're even vomiting. All of these symptoms I've mentioned are very classical of hepatitis B virus. Now, beyond all of this, by the time you begin to experience the next level, one, is that having itches on your skin. The body is itching you. Not that you ate something that you are reacting to. Just maybe some part of the body is itching you. Beware, it may be hepatitis B virus. Beyond that, you now realize that your eyes is yellow. You look through the mirror and you notice your eye is yellow in the mirror. Beware, that it means that you have hepatitis B virus. or even your skin, you don't look that you're looking white. That can mean also you have hepatitis B virus. So these are basic symptoms that everybody must know very carefully and then work against it to ensure that you are not just treating something else while you are suffering from another thing. That is very basic. Now, how do you now diagnose what is wrong? The first thing is that if you have any of these I've mentioned, please go and meet a doctor and mention all these complaints to your doctor. If you have treated malaria, let him know. If you have treated typhoid, let him know. And then the next thing is that let the doctor ask you more questions and be open and then be sincere. The next thing the doctor is going to run a test, ordinary blood test. If the blood test confirms that you have hepatitis B surface antigen positive, that means you have the virus. Now that's stage 1. You have to move to the next stage. And I'm going to explain this because a lot of people that are found to be positive and yet they do not go to the second stage. Second stage means you have to do the viral load. Viral load means that you want to determine how much of this virus is in your body. That will be done viral load. Among other tests you're going to do, you're going to do the hepatitis B panel. You want to determine the panel is a group of information that will provide whether it is just something that just started or it's been long in your body. So that's where you can classify hepatitis into acute or chronic. Acute means that something that just occur less than 6 months, or something that's been in your body for over 2, 3, 4, 5, 6, 7, 10 years ago. Now determines that. The next thing you're going to do liver function test. That's going to determine enzymatic activity of the liver. Has anything gone wrong in the liver? Then number 4, you're going to do your full blood count. You want to be sure that your blood system is intact. Number 5, you're going to do kidney function test. You want to be sure that the kidney also is not running into trouble, because once the liver is having a problem, it's usually extended to the kidney. The other thing you do alpha fetoprotein, and then you screen for cancer of the liver. You want to be sure the liver is not having some deadly disease. So those are the tests that will be conducted. And once all this is conducted and confirmed that the viral load is significant, once the viral load is about 1.7 million, then you are required to be admitted seriously and take necessary treatment. But if it's less than that, you'll still be on some medication, antiviral, that can actually lower it to the minimum bearers level. That is about diagnosis. Now, who should take treatment? Those that will need to take treatment are individuals that were found to be positive. Such person will have to be on antiviral, like tenofovir, entecavir, all these kind of drugs. You don't need to know them. They are very expensive drugs, or you need to take interferon 2 injections, and these are very expensive drugs. Now, the cost of treatment, of running the test, some of those tests I've mentioned to you so far, you will not spend less than 100,000 naira to finish them. Viral load alone is about 65,000 naira. Liver function test is about 10,000 naira. Full blood count will give about 2,000 naira or 3,000 naira. Kidney function test will give about 8,000 naira. And then you want to do scan also. By the time you add up all the costs of all these tests, you'll be getting close to 100,000 naira to run a test to determine how bad is this hepatitis in your liver. At this point, you take treatment to get these things treated. And I can assure you, it is treatable. You can be converted from being an active state to a carrier, and you can also be free from it with some other combination of drugs that will assist. Now, after this point, for those that are positive, what about you that you are negative? At what point do you need to act? And this is the main reason for this discussion. And especially for young ladies who are preparing to get pregnant, if you are found to be positive, you need to take a lot of treatment. Otherwise, you have a chance of passing this disease to your unborn child. So how does this disease spread? Who are the vulnerable people that should get themselves tested? Now I'm going to give you about 16 different sets of people that should watch out themselves to ensure they are not infected with this disease. Number 1, hairdressers and barbers. You all visit the hairdressers and barbers. They shave your hair, they do all sorts of things, they have contact with your blood. Sometimes they need to go and check themselves whether they have hepatitis or not. Number 2, drug addicts, those that inject themselves, they should go and check themselves. A lot of them end up having hepatitis. Number 3, cultists, those of you that get into some cult activities, you are initiated with one blade is used to mark everybody. You need to check out yourself. Number 4, if you are an individual that lives with somebody confirmed to have hepatitis, you get to check yourself. Number 5, if you are pregnant, you have to check yourself to know whether you don't have hepatitis. Number 6, if you have multiple people you have sex with, either a man, you have more than 2, 3, 4, 5 people you have sex with, or a woman of same category, you need to check yourself. Number 7, if you have ever had sex with somebody that you later realize she had or he had hepatitis B virus, you have to check yourself. Number 7, homosexuals, they need to check themselves because they are very vulnerable to catch this disease. Not only this, if you have been found to have any sexually transmitted infection before, for instance, you have had gonorrhea before or syphilis, you need to go and check yourself because you can as well have hepatitis virus. Or number 9, if you already know that you have HIV, you must check out for hepatitis B surface antigen. Number 10, if you know anybody that's a prisoner, a lot of the prisoners come out with hepatitis because what they do in that prison is deadly, and many of them end up with hepatitis B surface antigen. Then number 11, those of you that do tattoo, that pierce your ears and your nose everywhere, you get to check yourself because most of the time the blade or the needle that they use for somebody is repeatedly used for you as well, and that can also give you a problem. Now the next one, number 12, if you have done any test on the liver and the liver enzyme is found to be deranged, you get to check yourself. Now that's the gamut of a lot of people that need to check themselves as to get those that are vulnerable. Then finally, health workers like myself, nurses, pharmacists, laboratory scientists, attendants in hospitals, they are vulnerable. So you get to check yourself. Or sex workers, those women that do sex activities, they get to check themselves. Again, children that you are aware they had contact with another child who probably have confirmed to have hepatitis, that child also must be checked. And a child that is born by a woman who has hepatitis will be checked later after 6 months of birth to confirm this child do not have hepatitis. So these are people at risk that I've just mentioned. Now, who are the people that will need to take vaccine? Now, once you have conducted this test and it's confirmed that you are negative, then you are qualified to take vaccine. So vaccination is our discussion now. Now, I want to tell you that's prevention. Now, prevention is better than cure. And why it is better than cure is even cheaper. And like I mentioned earlier, the amount of money you're going to spend in diagnosing and treating hepatitis is too exorbitant for the quality or the economic status of you and I. And therefore, you need to do regular screening. Check yourself every year and be sure you don't have this disease. Any year you check and you confirm this disease is negative in you, the next thing you need to do is to take yourself and get vaccinated. Vaccination of this drug is available everywhere, and our friend hospital is also ready this year to offer people free tests. 25 people will come into our friend hospital to get a free test check on hepatitis, but you have to pay for vaccine. Vaccination is very important at this time. A number of us that are found to be negative should just go for vaccination. Otherwise, we are making ourselves more vulnerable because now some people around you are having the disease. They are not aware they are positive, and you are their friend. You sleep, you are together, you are doing something together, you share brush together, you're going to have hepatitis. You share blade to cut your nails together, you're going to have hepatitis. You share clipper together at barber, you're going to have hepatitis. So many are females that use the pin or needle or the napkin pin or whatever they use in pinning their hair. They're going to develop hepatitis. A number of women are pregnant are found to be hepatitis positive. And this is very, very dangerous in our community and in our society today. This disease is destructive because the complications is too terrible. What are the complications of hepatitis B virus? Number 1, an individual can come down with what is called liver failure. And know what that means? That means liver eventually cannot be in normal work as it were. Like those function I told you, it cannot perform this function, and that person is going to suffer till death. Number 2, the same hepatitis we are referring to today can also lead to hepatocellular carcinoma. We call that cancer of the liver. that means the liver eventually develop a cancer. And you all understand what it means to have cancer. So that's a complication that can come along. Again, an individual can also develop what's called chronic liver disease. Chronic liver disease means that the liver now fail to a particular level, sustain its function, and be failing gradually until it will finally fail. And the person will manifest some signs, like a man having like almost like a breast of a woman, or have some marks on his chest, or men that have the fertility problem, or female also that have a fertility problem, they end up having liver problem. Again, there are some people also that will eventually develop what's called vasculitis. Some of their arteries and veins will begin to get mottled, and they begin to have problem in flowing blood because they have liver disease. And I said earlier, the same liver disease will lead to kidney disease. So why do an individual want to make himself vulnerable? Why you can actually prevent this disease? It is very dangerous to keep quiet when you get to realize that you're positive. And it's also dangerous for you not to take vaccine when you realize that you're negative. And I can tell those of you that are on this platform today that it is not enough for you to listen to this lecture until you have acted on it by going ahead to take vaccine if you are found to be negative. If you are found to be positive, please ensure you move ahead to do the necessary things. And that's a treatment for this disease. We can live longer if we do the right thing. So you need to also adjust your lifestyle. Because one other thing that causes liver disease is alcohol. Those that take a lot of alcohol, a lot of gin, a lot of hot drinks, it destroys the liver and causes alcohol liver disease. Again, it can also cause fatty liver disease, whereby a lot of cholesterol have entered into the liver and where the liver cannot perform its function. So you get to be very watchful as those things that can destroy the liver. So finally, I can give you the good news that some people have been treated and they have been free from this disease, as it were. So you have people that were positive and were given treatment and they have now been converted to negative. And this occurs in our generation. So do not wait. And if you know anyone that is ravaging with this disease, please push them to a medical doctor and let them get treated. So I'm going to pause at this point in order to entertain questions or comments from our listeners and our viewers. And please, this is an opportunity for you to actually get informed so that you don't get deformed. Thank you very much. I'll wait here. Let moderator take over. I'm very grateful for those of you that listen. Thank you very much.
Thank you very much, Dr. Isa. Sincerely, this is a wonderful presentation. People comments have been coming in. We really appreciate your time-to-time presentations on health awareness. May God continue to support you, help you, and the whole our friend hospital team. The first question comes here that the vaccine is how much?
Yes.
Someone asked that
Okay.
the vaccine and the result is how much? If, since you are going to give us for free, but the vaccine we have to pay for it, is how much?
Okay. Now for the test, that's a good question. For the test, for the first 25 people that visit our friend hospital will get tested free. And that means the first 10% is totally free. The next 10% will pay 50%, and the next 5% will pay 75%. So that's like free for the first 25 people. And any other person that comes after the 25 will to pay for the test. But for the test is so cheap, we have made it cheaper for you so as everybody should get tested. Bring your family, your friends, your wife, your children. Just 1,000 naira to get tested first. And before you know, move to the second stage. If you are negative, you are free. If you are negative, then you move to vaccine. For vaccination, if you come as an individual, it may be expensive for you. You're going to take 3 doses within 6 months. 3 doses of this vaccine in 6 months. And 3 doses will cost you 15,000 naira. If you come as group, then you can get it cheaper than that. So we like you to come in groups of 5, then we'll reduce the price to you to half the price for you. And that's going to be the provision that our friend hospital want to offer the public as we do today.
Thank you very much. Which means a whole family can come and they have the vaccine. Thank you very much. That is a big opportunity from our friend hospital. Sincerely, at this time, this type of presentation always comes with money. The presentation to listen to a doctor, to an expert on a topic, we know how it's going everywhere. So we sincerely, coming from me, appreciating the work of our friend hospital. Anyone with questions? because in the next few minutes, we are going to round it off. Mr. Bulafis, you can unmute yourself and go ahead.
All right, sir. Good evening, sir.
You're welcome,
Thank
sir.
you very much. Thank you very much, doctor. May Allah continue to be with you, sir. My question is, you talked about those people that used to drink alcohol and those people that takes other things. What about the energy drink? Does it affect livers too?
Okay, that's a very good question. Energy drink is very, very dangerous to the liver. And in fact, majority of you that depends on energy drinks will end up with liver disease in the future. One of the things energy drink does is that it activates the liver enzymes. So the liver perform above normal. So with time, the liver is going to have disease. So majority of you that live on energy drinks will develop one disease or the other of the liver in the future. So I encourage people, and our youth are fond of that today. So people should learn to get energy from right sources and not from something that will overstimulate your system. Energy drink will overstimulate your liver and eventually destroy your liver. So it's a very nice question. Thanks for that attention.
Thank you, sir.
Yeah, thank you very much. Okay, we have 4 minutes to go. Any other question?
Sorry, sir. The second question I have is, how do we, because you said the first 25 people, do we now know if we are going to, if the chance for us to be within the first 25 people?
You have to visit our friend hospital.
Thank you, sir.
Once you visit the hospital,
to get your test done, you have to be there. It cannot be done by proxy. It's
there, and then you get tested. As long as you appear there, there's a register book that picks you up to say you're number 1 or number 2. So as you're being taken that number, then you are tested immediately. And so once you are negative, we encourage everybody to get vaccinated. It's very important this time. May Almighty God protect all of us. I use this opportunity to thank everybody that participated. For those on Facebook, thank you very much for those who joined. And for those on the Zoom meeting, thank you very much. We promise you very soon we'll be coming up with other topics and very important discussion. And we want you to enlighten people. Please share this as much as possible. We're going to send the video later after we have edited it. And then we promise you we will continue to give you the teachings that will save us. Thank you very much for coming. And we appreciate you all. Bye.